My name's Simon Fowler. I farm 100 kilometres east of Esperance with my wife Robin and my brother Andrew and his wife Mari. We run a large broadacre cropping program and we run a couple of thousand breeding cows, and we finish our steers and heifers for Woolworths, and we also shear about 50,000 sheep a year. I've been involved with ASHEEP for at least 15 years now. I've really enjoyed the experience. Great group of growers, like-minded, all really progressive and want to improve their own enterprises and the district. As a fairly large cattle operation, we found one of the most frustrating parts of our cattle enterprise was bull breakdown. In the worst of the seasons, we would lose half our yearling bulls to Balanoposthitis, and that was really frustrating because the amount of investment we'd made in genetics was wasted. It was coming at a big economic loss to the farm, and also resulting in poor pregnancy rates in our heifers. We really had to come up with a solution to this bull breakdown. We thought the vaccination would help based on our local vet Enoch's theory of the link between the herpes virus and bull breakdown.
Enoch Bergman, veterinarian, been in Australia for over 22 years. I work here at Swans Veterinary Services, run about 1,000 breeders myself and cropping enterprise as well. And just love cattle and love helping producers and cattle. My job is to improve the profitability of producers without sacrificing welfare outcomes, and I take those two goals very seriously. Losing a bull is expensive, but losing a bull that you've planned on improving the genetics of your herd is even more expensive. Cows that don't get pregnant is the most expensive of all. As you can imagine, if you paid 7 or 8 grand for a bull and he broke down with Balanoposthitis, and then you've got to sell him onto a truck for 1,500 bucks, or if he's broken down severely enough that he's no longer of commercial value, then you've lost that entire investment. But the flow-on impact of it in regard to genetic loss and in disruption of your calving pattern can be much more significant. We'd found locally that we had a very high incidence of breakdown in young bulls, especially virgin bulls, in the first couple weeks of joining. It was quite consistent. You go from place to place to place, and so in isolation, a lot of producers I don't think realized just how endemic it was and how it was profiled so acutely to young bulls early in the joining. And so we started collecting bloods to see what was going on, and we're consistently finding antibodies to herpes virus. Bulls that have never been exposed to IBPPV, infectious Balanoposthitis pustular vulvovaginitis, when they encounter it for the very first time, and they'll get it from either a cow or from a bull that served a cow, and it's a herpes virus, so once you've got it forever. It's like luggage. The first thing that you'll notice on a bull is that there'll be a bit of swelling on that prepuce, and then if you do happen to see him serving, you might notice small ulcers or even just little raised red inflamed tissue on the penis. From there, it can quite quickly progress to full-blown Balanoposthitis, where the prepuce and the penis are incredibly inflamed and swollen, and maybe the penis itself has got paraphimosis and it can't go back in the prepuce.
On the back of Enoch's theory of the link between Balanoposthitis and the herpes virus, we've been vaccinating for about 10 years and seeing some really good results. When this project came along with the help of MLA and Enoch, it was a great opportunity for us to put some science behind what we were doing on farm, and we've been really happy with what we've discovered so far.
So the vaccine that we're using, specifically Rhinogard, was a feedlot vaccine, and what they found there is that if an animal's in a feedlot for an extended period of time, they would revaccinate them because, like all vaccines, they stimulate an immune response, but that immune response wanes over time. So we're encouraging producers who sell bulls to vaccinate their bulls prior to sale, to revac them regardless of whether they've been vaccinated before prior to joining.
We were having large numbers of bull breakdown before vaccination, so up to half the bulls. Post-vaccination, we're seeing really minimal. 2024 was 1 bull out of 16. 2025 was 3 bulls out of about 20, so the numbers are really low now, and we're also seeing a lot less corkscrewing in the older bulls when we do our bull testing.
Corkscrewing is premature spiral deviation of the penis, And bulls, when they achieve intromission at the last minute, they'll corkscrew their penis. But some bulls, if they injure their penis and scar that dorsal apical ligament, it makes it shorter. So whenever they gain an erection, they'll start corkscrewing prematurely, and then they can't achieve intromission, they can't get it in. So they end up fertilizing trees and things like that instead of mating cows. Our sand plain here exacerbates it, our environmental conditions. If it's wet and sandy, that sand is quite sticky and gritty, and it's abrading those prepuces, and then what happens is they get a secondary infection, they get inflamed, and then they will get tears or rips in the prepuce, and then it goes really bad after that. But in the process, I think that penis is also being scarred a little bit, and I think that's causing that shortening of that dorsal apical ligament, and it could be that some of the corkscrewing we see could be bulls that have survived Balanoposthitis previously. And in Simon's case, I think the first time I jump tested your bulls, we had about a third of them that we culled for corkscrewing, which was heavy. And now we'll probably only do 2 or 3 a year with corkscrewing.
Anecdotally, we've got substantially less.
The response has been great. The proportion of the people that we surveyed that chose to vaccinate increased consistently. When we compared the vaccinates versus the non-vaccinates, in the first year it was about a 6% reduction in the vaccinates. That year was quite wet, we had quite a bit of breakdown. In the second year, I think it was a substantial reduction, about 12% reduction, which is quite large. And then the last year, I think it was a 7% reduction, around 60-some% comparatively. So that's 50 properties that we've surveyed. The average on a scale of 1 to 10, how likely to vaccinate next year is a 9.7 out of 10. So,
because of the results of the project have been so positive, vaccinating bulls is now just standard pre-joining procedure on our farm. And I think across the whole district, it's just standard protocol. People vaccinate their yearling bulls. The cost of it is insignificant compared to the production benefits.
MLA runs an amazing program called Producer Demonstration Sites, and what those are geared towards is if you're doing something locally that's beneficial to local producers, that gives you a bit of funding to run a PDS site so that you can actually capture some data and then put MLA in a position to be able to extend that information outside of your catchment, outside of your area, to benefit other producers around Australia.
The motivation for hosting a demonstration site was just the opportunity for us to put some science behind what we were seeing in the paddock, the opportunity to collect some good evidence, some good data across the whole community about Balanoposthitis. As it was such a big economic loss to our enterprise, the opportunity to try and find a solution was really important. I think the format of the PDS was really good because through Enoch's network we had producers from across the whole Esperance Shire. It just created that level of awareness that was probably not there, but because of the PDS we could reach out, get a lot more people involved, and I think that resulted in a really good level of education. If you get involved in a project like this, it benefits your own enterprise, but it also benefits the whole community. So there's real value in putting up your hand, being involved, learning for yourself, improving your own enterprise, and then that stretches across the whole community and the whole country.
If you live in a community and you're doing something great that'll benefit the rest of Australia, go talk to your local producer group. If you don't have a local producer group, start one. And then once you've started one, call MLA, get involved in the PDS program. So it's a great way to disseminate things that you do well so that other people can do just as well. All over the country, people are aware of what's happening.
So now we are much better at identifying a bull with an issue earlier, giving him the opportunity to recover. So there's a much better animal welfare outcome through the awareness of the problem.
Bulls, remarkably, are insanely stoic. And that's part of the reason why they continue to break down. So they'll get an inflamed, annoyed penis, but we put them in there for their 9-week joining, and they're very keen on getting that job done. They're good employees in that regard, but they're not very good at looking after their gear. No producer likes seeing any animals suffer, and these look bad. It's something we'd love to prevent.